So I want to tell you about something that happened to me when I was 8 years old, which was the local library got one of the first BBC computers. And my sisters, my friends and I spent the summer booking 1-hour slots to go to the library and play on the latest heavily pixelated game. When we set school projects, the information we had at our disposal was, of course, the couple of paragraphs in the encyclopedia that you had at home that you regurgitated onto your paper assignment. But, of course, all this has changed. My children rely, in fact, they're dependent upon digital sources for their education, for all of the information they receive, for socializing with their friends. And of course, that's the story of my digital transformation, but you will all have your own, and those of the young people around you. When we started the Lancet Commission 2 years ago, the question that we wanted to ask was, recognizing that health is relatively unchanged compared to other avenues, my children, who do their homework online, have their vaccination records on paper, what effect could digital health have on health? And how could this happen? You know, this was not universally accepted. People at the time said, Lancet commissions are supposed to look at areas of health which are neglected. Digital health is not neglected. It's commercial. In fact, it's peripheral. It's a distraction, we were told, from what it is that we're trying to do, which is to deliver UHC. A Lancet commission, it was said, could risk fanning the flames of this overhyped commercial field. Let's fast forward 2 years. Now, we're in such a pivotal moment. Not only do we understand the power of digital health through the pandemic, we've had Rand's work, his research, leveraging Israel's large-scale electronic health database to look at real-world vaccine effectiveness, was the first research to do so. We had the UK recovery trial, which was the first trial to deliver a positive therapeutic result for COVID-19, which also leveraged UK electronic health records. This morning we had Dr. Tedros talk about the new WHO Pandemic Preparedness Hub. He talked about data, he talked about quantum computing, and he said it's time for public health to catch up. But although there's no doubt that we need it, we're also at a moment where social media, we understand, has played a key role in misinformation around vaccine and affected vaccine hesitancy. We've been hearing about Facebook's role in the health of young people, particularly young women, through the US Congress hearings, and also Twitter's role in the storming of the US Capitol and the effect on our democracy. Although the pandemic has pushed us online, what we now know is that all of the work that we have done to build equity has not automatically come across with us. We're facing new challenges, and we must be conscious about addressing them. So the question that the Commission asked and answered itself was in fact much more foundational than the one that we set them. They asked themselves, what effect has digital transformation had on health, both directly through vaccine information, through digital therapeutics, through artificial intelligence, and indirectly through the effects on our social system, our economics, our commerce. The Commission tells us most transformations are not on track to deliver improvements of health for all. And in fact, being intentional about this new path, delivering on the Commission's recommendations, accountability, trust, public participation, data solidarity, are essential to our future. So I'm going to ask you to do 3 things. The first is, in a moment, to join me in thanking, on behalf of the Lancet, on behalf of Richard Horton, who couldn't be here today, but sends us his very best wishes, thanking the chairs, thanking the commissioners, thanking the secretariat, thanking the funders, thanking all of those, including the reviewers, who supported the Commission in their work to get here today. I would like to invite you to read the report. It's available online. And I would like you to understand that digital health is not only essential, but it requires urgent improvement. And thirdly, I'm going to invite you all to watch a short video about the Commission.
Our world is rapidly changing. Digital technologies and data are changing to health and the design of health systems. But governance models haven't kept up. This creates uneven effects globally. The Lancet and Financial Times Commission, governing Health Futures 2030, Growing Up in a Digital World, shows how digital transformations are changing our health futures. In October 2019, 19 commissioners were brought together to develop the report. These commissioners considered a wide range of governance approaches, ethical guidelines, and institutional responsibilities that must be considered to improve health and well-being in an increasingly digital world. Commission meetings prompted open dialogue and shaped the heart of the Commissioner's report. The Commission engaged with stakeholders, including various international organizations, non-governmental organizations, and decision-makers at the global and regional levels. The novelty of this collaboration between the Lancet and the Financial Times also allowed for private sector engagement without compromising the independence of the Commission. There were 3 key findings. First, young people's experiences growing up in a digital world are just as diverse as their lived experiences. They are excited about the benefits digital transformations will have for their health and well-being, but they are concerned about online risks, finding trustworthy information, knowledge on how their data is being used, and whether these technologies are grounded in human rights. Secondly, the Commission identified a solidarity-led approach to health data and addressing digital determinants of health to be important for maximizing the public health value of digital transformations. However, these are missing from most governance approaches. Lastly, we discovered that all countries are looking to use digital technologies to improve their health services and make better use of their health data. Most countries have already developed digital health strategies, but they are yet to adopt an approach based on the principles of data solidarity, digital trust, accountability, and public participation. The Commission found that these principles are key to advancing health equity and resolving privacy concerns. Digital transformations have the potential to improve everyone's health and will allow young people to have a role in making decisions about their health futures. But this is only possible if collective action is taken to strengthen the governance of digital technologies and data, so they benefit everyone. For this to happen, governments, companies, and other organizations must take collective action by building a governance architecture that fosters trust, addresses the role of digital technologies as determinants of health, enacts a new approach to data collection and usage based on data solidarity, and invest in the enablers of digital transformations for public health and UHC. Our health futures are being decided now. If governments and companies adopt a value-based approach to governing digital transformations, everyone will move one step closer to reaching a sustainable future where health for all is realized.
So well done. You've already done the third thing I asked you to do. There's only the second, read the Commission. And now I'm going to ask you to do the first. As we invite the co-chairs, Ilona and Anurag, to present the Commission to us, please join me in thanking them and thanking all of their commissioners for the work on this Commission.
So good morning to all of you, and from my side also a wonderful hello to my co-chair Anurag in India, New Delhi. And it's been an enormous privilege to work with such a wonderful co-chair and such a brilliant group of commissioners. A real strength of the Commission has been the rich diversity of perspectives and ideas that they brought to our work, coming from very different backgrounds, sectors, and expertise, a truly interdisciplinary commission, and to some extent also a commission different, as Naomi has said, to other Lancet commissions in terms of the disciplines, in terms of their orientation, and in terms of the challenges they brought to the Commission and our work. Some of you know that we started our work, you just heard it, in 2019. Actually here in Berlin, we were able to meet at the Charité, but just a few months after that, COVID-19 disrupted everything. And it's unfortunate, on the one hand, that we were only able to meet once in person, and some commissioners I only meet now, again, here at the World Health Summit. But somehow it was also symbolic and fitting because, since we're working about the digital world, we were really forced to work digitally. And experiencing that, and actually, I think, being successful in doing that has been a truly extraordinary experience for all of us. And working on digital transformations, I think it has also transformed us in a number of ways. Naomi has already indicated it that COVID-19 did highlight the timeliness and relevance for this commission. When we started, we were still with a mind frame, well, we're future-oriented. And suddenly, the future was here. And so many of the issues we started discussing have become part of the public debate. Some of the issues we were seriously concerned about have now been taken up by other international organizations, for example, by the Human Rights Commissioner, to name just one, or the Secretary General, to name another. People are now much more aware of how much we depend on digital technologies, but also on the way in which digital technologies and data can help us resolve and respond to health challenges. But, and this is the big warning that our Commission brings to the discussion, we are also much more aware, just think of the recent Facebook discussions, of the way in which digital transformations or the exclusion from digital transformations can be detrimental and is already detrimental to our health and to our rights. And this message we will always be coming back to as we discuss the results of our commission. I'd like to hand over now to Anurag to make the next points. Please, Anurag.
Okay, I just wanted to start off by thanking my senior co-chair, Ilona, who has done much of the heavy lifting that you will hear about today. I would like to emphasize the second part of our commission's title, Growing Up in a Digital World. As the title suggests, we spent a lot of time considering what it means or will mean for young people to grow up in a digital world. Specifically, we asked a very simple question. Digital transformation is not just a positive thing, not exclusively, but can also negatively impact health and well-being of young people if not handled well. And we were very lucky to not only have older commissioners with expertise in youth and technology, but also to have some quite young members and quite almost young members, because we always wanted that youth must play a very significant role in this commission. So based on efforts by the Secretariat, rather than simply have a youth commissioner as a namesake, we actually secured funding to establish a whole youth team. You will hear from some of them later. And of course, you must get diversity of opinion. This diversity of opinion is something you saw in the video itself. And we got some great partnerships. Organizations, UNICEF, IFRC, Harvard University. So we could listen to experiences and opinions from around the world. And seeing these issues through different sets of eyes, young people's eyes, influenced our work. It made us determined to develop recommendations that are future-looking, mission-oriented, and grounded in some core values. Ilona.
Thank you, Anurag. And I might mention here also the very special relationship with the Lancet and with Naomi. And you can see we're even color coordinated as we do this launch. So for us, it was very, very challenging to distill 2 years of discussion and research into one report. And Naomi really knows all about that, cutting words continuously. Our task was, and I reiterate that, to explore the conversion of digital health, artificial intelligence, other emerging technologies with universal health coverage. and to pay special attention to children and young people. Quite a mouthful that we were challenged to deal with, and you might remember the pyramid from the video that you just saw, where we tried to put that in some order. And I'm sure you will acknowledge that a whole report could have been written on each part of that equation, and surely there is a lot of reports that are available from the Commission Secretariat. We made clear that digital transformations in health, and it's not just one transformation, it's many transformations, are very much embroidered within broader political, societal, and economic processes. The impacts of these digital transformations are wide-ranging, and there is still very much that we don't know, particularly how they can help or harm our health. We decided to be bold and focus on changing the narrative around digital health and setting a new vision for governing health futures that would remain relevant no matter what further digital transformations await us. Anurag.
Thanks. And I think in the report, what we do to start off with is to call for a greater recognition of the fact that these are the new determinants of health, digital transformation. We can no longer ignore the ways that these technologies are driving the health transformation directly and indirectly through influence on other determinants of health. And we call upon a culture of data justice and equity, because all these transformations will lead to huge amounts of data with a lot of public goods potential, but we must simultaneously protect individual rights. It has to be a balance between the individual and society. Both have rights. We argue that digital transformations are changing our understanding of health itself. What health means will become progressively more wellness focused as we get much more data before the time people fall sick. And of course, delivery of healthcare and health services will be transformed greatly. So therefore, we think that public health and UHC need to be almost reimagined in this new world to reflect the role and the potential they have with new technologies and data in achieving them. And of course, as our name suggests, we make the case at all times for putting children and young people at the center of all of this. If we can create an environment, governance, mechanisms that work for children, something that's good in the very long term, everyone will benefit in time to come. Ilona.
So just to highlight some of our recommendations, we believe that to achieve universal health coverage and create better, more sustainable health futures, we need to address the power asymmetries that have been created by digital transformations, both within and between countries. We feel very strongly that there needs to be a strategy to increase public trust in a digital health ecosystem and to maximize the opportunities of digital technologies and data for public health. In order to do this, we need a value-based framework for governing health futures that puts public purpose before profits. Governance approaches should be grounded in health for all values of democracy, equity, solidarity, inclusion, and human rights. As you've already seen in the video, our report proposes action in 4 areas. We consider these to be game changers for shaping health futures in a digital world, and Anurag will outline them more for you.
Thank you. The first is that decision makers, health professionals, and researchers must consider and address digital technologies as increasingly important determinants of health. This, I've said before, is very important. Secondly, they need to build a governance architecture that creates trust in digital health by enfranchising patients, vulnerable groups, ensuring health and digital rights, and regulating powerful players in the digital health ecosystem. Third, we call for a new approach on the collection and use of health data based on the concept of data solidarity for larger purposes. And finally, last but not least, we urge decision makers to invest in the enablers of digitally transformed health systems, which will make all this a reality. Thank you.
Thank you, Anurag. And we are therefore very excited to present the final report to you. Obviously, it's digitally available. Actually, it's not here in real life yet. It's in Leipzig, if any of you are going there. But I thought you might want to see a hard copy, as we say. And it's been quite emotional for me to finally hold it in my hand. We really look forward to hearing your feedback and ideas for how to translate our recommendations into action. We'll hear later about some country examples straight away. Please do visit our website where there is possibility for feedback. And you will see over the next couple of months a whole range of invitations and events where you can comment on the report, its recommendations, and where we will be working with you, actually already one later this week. We are also very, very grateful to our funders and our co-conveners, the Lancet and the Financial Times, for making it possible for the Commission to do this work. And I've already indicated how incredibly supportive Naomi and Andrew have been in this process. And I give the floor back to you, Naomi, to help us dig deeper.
Ilona, Anurag, thank you so much for presenting an outline and the recommendations from the Commission. Now I'm going to invite Andrew to join me, and we're going to have a discussion digging deeper into further the recommendations with some of the commissioners and also with some external thoughts from Marilee Scorgans from the World Bank. So Andrew, thank you so much for joining me. We also have Andrew Wyckoff from the OECD who will be joining us online. We have Dr. Sumia who's joining us here in person from the WHO. We have Nanjira Sambuli who's the co-chair of Transform Health, who I think is here in person, and we have Marilee Scorgans from the World Bank.
Thanks very much, Naomi, and also I'd like to say on behalf of the Financial Times, it's a great pleasure to co-convene this commission over the past couple of years, and alongside, of course, the great work you can see on their website and in the Lancet's publications, the FT also has extensive coverage that continues on some of the wider issues and trends and implications around this very important issue. Now we're going to talk to some people, both some commissioners and some who've been following the work of the Commission more generally to get some insights. But maybe, turning, if you've caught your breath, Dr. Sumia, great to see you. Now, of course, you are with the World Health Organization, but also you were a commissioner. Tell us perhaps what you found the most surprising, revelatory finding during the work and the discussions and the research around the Commission leading it to its conclusions.
Thank you, Andrew. I mean, I enjoyed the entire work of the Commission because I think it broke a lot of new ground and really addressed a very important issue for us, especially when we look at what's happening at the country level and the way people are accessing health information now. But I particularly was impressed by the survey that was done amongst youth that came up with their priorities and thoughts on what is important. And I think particularly a couple of points there, one was really about inclusivity. And I know from my own experience in India and other countries that there are still large parts of the population that are not digitally connected and are completely left out. During the pandemic, education, health services, they were excluded from all of that. So I think I'm glad the Commission now talks about digital connectivity as a fundamental right, because I think it underpins your access to education, to health, so on. So I think that was a very important point, that youth want to be included and they want to be connected and they want their capacities built. But also, I think the governance issues and again, having a governance structure where civil society and particularly youth are involved and empowered and co-creating those structures. That's the only way really forward, I think, to build trust in the system, particularly when they were going to collect large amounts of data. I think the data solidarity concept is also key, and I'm glad that we're using that term now, because really people need to understand that the data will be used to benefit them and others like them, the public in general. But again, I think it'll take time to build that trust, and we have to start, and we have to make sure that we do it in take the right approach while doing that. As far as WHO is concerned, I think we are very much aligned with the messages in the report. And since we created the Digital Health Department also in 2019, around the same time that this commission started its work, we're focusing on the normative aspects. For example, we've recently come out with a report around the governance framework for artificial intelligence in health, what the principles should be, and very clear checklists for the developers of AI technologies, for ministries of health to how to govern those, and also for the providers who use AI algorithms. And finally, I think that this area needs a lot of research, because we cannot presume that everything that's digital is good. We've heard that there's a lot of harm that can come as well. And therefore, I think initiatives like IDARE and others, through those, we need to really make sure that we get much more research being done in this area and really studying the impact. Because ultimately what we want to have positive health outcomes. So these things are all tools and a way to get there. But if we're not having an impact on health outcomes, then we need to rethink and step back.
Thank you, Dr. Soumya. You picked up on so many important examples there, but of course one that I don't think had been mentioned previously was the idea that the Commission had recommended online access or digital access as a human right, which is a really kind of transformative way of understanding this. So thanks for highlighting that. Andy, let's come to you. You were also one of the commissioners, and you're also, of course, work for OECD. Can you tell us what were the key recommendations for you, and perhaps for your organisation? What was the most meaningful part of the Commission?
Good morning, and thanks, Naomi. I think there were three that really stand out for me. And the first is just the recommendation to raise awareness. I guess I'm a little bit surprised at how slow this sector is to begin with the digital transformation. When I look at other sectors like finance and retail, or even now education, they're making great progress. And I think health has been reasonably slow. COVID, I think, gives us a boost, which is great, but also the slowness is an opportunity to try to get the governance architecture and practices right and learn from other sectors. So I think some ways that shortfalling is a good one. The recommendation that really gets me up is the need for governance architecture, particularly around data. I think data is a new resource as it's configured today and is poorly understood, and our policies really are ill-suited to dealing with it. And with this comes the whole concept, which I think is one of the more important recommendations of the report, which is data solidarity, which I think is just a really nice way of phrasing what we would say at the OECD is enhanced access and sharing of data, which is far more complicated. It's the same meaning that you have to blend the private individual needs with the public good. And we do that in many other areas. I think education is a good example where society benefits from having a skilled and well-educated populace. Now, the same is true here with individuals' health data, helping us collectively as a society. So to me, that's the big one, which I think all countries need to progress on.
Thanks, Andy. An interesting point there about the relatively slow pace of transformation into digital of health, or at least perhaps parallel developments, but not always intersecting between sort of commercial expansion in terms of movement indicators and data exhaust and so on the one hand, and sort of core health provision on the other. But Nanjira, let's turn to you. You might want to say just briefly, for those who aren't familiar, just describe Transform Health that you preside, and give us perhaps the biggest surprise for you in the insights and the recommendations from the Commission.
Sure.
Good morning, everyone, or good day as it applies. I'll start with answering. Transform Health is basically a responsive mechanism to this process with the Commission, which is a global coalition, advocacy coalition, to advance the recommendations from this report, and particularly the very important conversations around governance and governance of data in this healthcare sector. Now, on what surprised me, I think building on what Sumi and Andy have spoken, coming from previously working on sort of like universal access to the internet issues, realizing that in sectoral focus areas, this was not a conversation that was obvious, right? Those are the determinants towards digitalizing healthcare and using digital for even the sustainable development goals. So having to go back to that almost 101 conversation was interesting. And related is still finding the rose-tinted glasses view that it's all this net good approach that will just move fast and kumbaya will happen kind of thinking that was quite prevalent with healthcare policymakers, so to speak. And realizing that we need to bring a complexity to the narrative about the place of digital technologies that pairs the positives and the potential pitfalls to make sure that we do not enter a situation where unintended consequences is when we start talking about pitfalls. Because in this case, unintended consequences are life and death elements. And this is really, really critical for the healthcare sector. So that's been really interesting to bring in. And I think one element we couldn't bring into that conversation yet, but is a natural extension to the Commission's work, is actually how we secure all these systems. So cyber readiness and cybersecurity is going to be just as important as talking about whether data-enabled systems, cloud infrastructure, and so on and so forth is part of it. But bringing these holistic conversations is quite a mind shift for a lot of folks, not just in the healthcare sector, but those who are more digital advocates. But it's where we need to go with the narratives about the role of digital technologies, what is appropriate, what is contextual, what is sustainable in different communities, which bring different diversities to this table.
Thanks so much. So coming now to you, Marilise, as the person on the panel who was not a commissioner, can I ask you, what were your first reactions to the report?
I will say that when I first got a first copy of the report to read and to review, one of the thing that probably surprised me the most was the focus on data governance. I remember I was there at the World Health Summit in October of 2019 when the Commission was launched. I sat in one of those very white chairs as you guys are sitting in. And I remember at the time that the focus was more on digital health technology as opposed to digital health governance. And at the time that the Commission's work had started, the World Bank had also just started with our World Development Report. And in fact, the World Bank's 2021 World Development Report, building on the 2016 World Development Report on the digital divide, is on data for better lives. And so what I saw was this concomitant, simultaneous discussions happening in the World Bank around the value of data, the new social contract for data that rests on trust, value, equity, at the same time that the Commission's work was really pivoting from a focus on the technology to a focus on the use of the technology to solve pernicious health challenges. And to me, if we want to be successful, if we want to look back 2 years, 5 years from now and say, were we successful in the digital health revolution and evolution that is taking place, I think that the success is going to depend not on the technology, but on the extent to which we've been able to transform and reimagine how healthcare gets delivered. So, and of course, data governance, which is one of the core themes of the World Development Report, it's not just an issue in health, it's an issue across all of development, is how are we going to be more successful in ensuring that as we understand and recognize the social contract for data, the economic implications, and the not just national, but international data governance requirements that are needed, how we're going to be successful in that space. So it's been an interesting evolution and process to watch from the perspective of health and digital health, which is the sector where I work, and also more broadly thinking about thinking about data in its widest development context. Thanks, Naomi.
Thanks, Marilise. So we're going to move to some questions. A reminder, use the hashtag GHFutures2030 or send it in by other forms. We've got a couple online, but do please also raise your hands here. So there's one here from Tabitha. Great to hear strong messages on equity, inclusion, and rights in digital transformation. Turning these into reality needs good governance. How can communities, including youth and civil society, be meaningfully involved in digital health governance to uphold human rights? Nanjira, do you want a word on that?
Sure. I think I'm always, we had this during the Commission's tenure, just thinking about what are the appropriate ways to have intergenerational dialogue, which is so critical for these digital health futures we're going towards. With the understanding that we, as younger people, are not necessarily the ones at the reins. So how do you make sure that the involvement of youth is not just lip service and sort of like a compliance element, but the existential crises that is really what is at the root of what a young person's reality is today, humbles those who are power holders to actually ensure that the kinds of policies, the kinds of interventions they choose to adopt, and even more importantly, stop using, are incorporated. We, as yet, do not have enough mechanisms across societies at subnational levels or global levels that allow for that kind of thing. We're still at a path where it's a bit awkward between the two groups when they come together to have this conversation, but I think the Commission really tried to start normalizing the fact that young people are not an afterthought. You're not just this sideshow that is consulted, extracted from, and narratives that pepper reports, but really showing that, that has to be placed not just front and center, but towards building this sort of way where we can have this intergenerational insights that inform the kinds of health futures and present that we're going towards. So, the governance element is also just really about the political conversations we need to have beyond rooms like these around, do we have institutions fit for purpose in this day and age that accommodate, for example, the intergenerational aspects we're talking about, that can be held accountable to what they say about what they're doing for young people. Absent that, the urgency of that is the sort of like angst that is so prevalent across communities will end up bringing more complications towards the futures we're heading towards if they're not addressed. So that remains a very evergreen, ever-present challenge. And I hope that we can always just keep it as a question towards which we're resolving. I cannot stand here and say there's a one-size-fits-all approach. Just carry it on, and in every sphere of work, what's the kind of intergenerational dialogue and decision-making being enabled?
It's amazing. I know that we could sit here and talk together for a very much longer time than we have. We only have a few more minutes. So I'm going to ask the rest of the panel to come back to us with very, very short answers in terms of what next? What would you like to see happen now to make the findings of the report a reality? What needs to change? Dr. Simia, I'll come to you first.
I think we need actions both at the global level and at the national level. At the global level, I mean, the WHO, we're very much engaged in, through the digital health strategy that we have approved now, to work with member states to set up some of these governance mechanisms. I mean, the broad framework of rules can be set at the global level, but ultimately, I think each country needs to really start this dialogue intergenerational, but also interdisciplinary. You need the social scientists, the psychologists, and others also part of this discussion in order to define the rules. So, and ethics has to be at the center of it. I think ethics and equity, we shouldn't forget these two.
Thank you so much. Andy, let's come to you.
I think we need to instill the sense of urgency and get on with it as quickly as we can. And with this comes resources. And to that end, official development assistance, I think, can be better tagged to help support this. I think it's going to be a win-win on many different fronts there, not only helping connectivity, which has spillover to many other things, but directly for health for the future going forward. So it's a matter of getting some money and resources. And I think this is part of the battle cry we need to lead with.
Thank you, Andy. Marilise?
I agree with what both Simia and Andy said on the supply side in terms of how we think about health systems. I think what we also need to do is to build better demand for digital health services. I think that when it comes to healthcare, people vote with their feet. People go to where they perceive they'll get the best healthcare. why we see more patients at outpatient facilities in district hospitals than at many primary healthcare sites, for example, for things that could have been addressed at a primary healthcare site. So when it comes to digital health, I think building the confidence and the trust amongst clients of healthcare systems that digital health is not a second tier way of delivering healthcare, but it's a first tier, digital first, digital quality health services. So for that, we need regulations, we need accreditation, we need everything that goes with building confidence in our client populations that they would want to access digital health services or receive healthcare in a digital world. Thank you.
Thanks, Marlies. I think we have one more minute, so perhaps we'll squeeze in one final one for Nanjira, which comes from Bram Wagner on Twitter, who asks, what advice do the panelists have for young people who want to get involved?
Stay loud and proud, honestly. It's your time, it's our time. We are the ones who are really inheriting this earth where, in an age where the cans have been kicked down the road, waiting politely for the turn to come is not really the way to go. So in spaces like this, you're valid to bring your perspectives and to challenge everybody who's saying is working on your behalf.
And with that.
Yeah, so thank you, Nanjira. Thanks to all our panelists for this fantastic motivation. And just a reminder, so I mean, the runway has been built somewhat now with the Commission's work, but this is very much going to continue going forwards, both with on the Commission and its activities with the FT and the Lancet. So stay tuned.
Brilliant. Well, thank you to all the panelists. We're going to now hand over back to Ilona, our host. So thank you again.
We felt very strongly that since many of the commissioners couldn't be here, that we did want you to get to know them, that we could listen to their voices as well. So we've asked them to give us some very short statements, and we'd like to share them with you. So please, could we have the commissioner statements, the videos, please?
One of the reasons that I've been so excited about being a commissioner in this report and during the process of talking to the other commissioners is that the issues of connectivity and health access are inextricably linked. We note in the report that half of the world's population doesn't have access to modern progressive health services, and the same number doesn't have access to the internet. And there's no coincidence about those numbers. Equality in the digital age is predicated on being digitally connected. And we look forward to the report and seeing the findings of it be published so that we at GIGA, with ITU and UNICEF as our partners, can use these numbers, these figures, and some of the insights from the report to ensure that everybody in the world has access not only to a fair health future, but to a fair future full of opportunity, choice, and dignity.
I think the work at the Commission really helped me a lot to appreciate, first of all, the great potentials of AI and other related technologies that really the potential to help to expand and provide a high quality health service to to people. So I think I got a much better understanding of the potentials. But at the same time, that also the work has also exposed me to some really potential risks that such technology might bring to the society, and also some ethical challenges that we may face. So I think that's sort of one aspect that actually helped me to think how actually, we can better improve the governance of technology so that we can bring the gap. So that's one aspect. The other aspect is on the young people. I think our college have very talented and very lucky young people, but also there are many more around the world that I think have the same potentials, but they don't have the opportunities. And I think, our technology can help to improve the health and other services to these young people to fully tap into their potential for a better future of the world.
It was my privilege to be a part of the Governing Health Futures 2030 panel for a number of reasons. First, it allowed me to interact with a number of people from diverse disciplines, and we had several deep discussions on our perspectives, the way we brought them to the table, and then how, through our final report, they've come together in what I think is a cogent set of thoughts and recommendations. Central to them is the concept of data solidarity, which I like very much because it captures the two things that I think this commission was about and should reflect. One, data, because data, after all, is what increasingly govern the way we live and the way that new technologies roll out. And second, solidarity, the fact that we're all in it together, that data are both private and public, and that it is our health, our economic well-being, and the quality of our society that is ultimately determined by the way we govern our health.
I'm a sociologist, so one of the things that I was really interested in was social injustice and social inequalities when looking at the access that young people have to digital health, but also universal health services around the world. And I really learned from my work in the Commission that there's a massive disparity between particularly young people in the global north and young people in the global south, where there is very little access, not only to digital technologies for health, but to universal health care and other really important dimensions of promoting and protecting young people's health, such as access to healthcare services, clean water and immunisation services. These are the things that I'd really like the Commission to focus on moving forward, and not only in relation to providing digital technologies for young people to promote and protect their health and improve their health moving forward in their lives, but as the COVID pandemic has shown us, lack of access to digital technologies in general also has a huge influence on people's work-related and education-related opportunities. And these are the broader issues that I think are really important to pursue further, building on the Commission's work.
Thank you very much for that. Could I ask the commissioners that are joining me on this panel now to please come on stage? And we will continue this view towards what does this mean for the work of the commissioners, but particularly what does this mean at the country level? And the way we have phrased that in our discussions was to say there are sort of two dimensions that intersect what experience at country level, because obviously they had a day job next to being commissioners, what experience at country level influenced the kind of points and the kind of issues you brought to the Commission, but also the other way around, as you were working on the Commission and on the recommendations, what impact do you think this can have at country level? And I'd like to welcome the commissioners that are here with us. Anurag has come back to join us. I don't know if Janet Vega from Chile has been able to join us yet. I hope that is possible. We have Njid Ndili from Nigeria and Rand Balacha from Israel that will speak to us about some of these country experiences. I hope Jeanette will still be able to join. Anurag, I think we wanted to start with you, and just envisioning you are in a country that has now vaccinated 1 billion people. Just trying to think of that, 1 billion people. Did this have anything to do, does it have anything to do with what the work of this commission has been?
Thanks, Ilona. Wonderful question. Minor correction. Although equally big milestone, India hit the 1 billionth dose last week, which doesn't quite equate to 1 billion people, but it's a still massive, massive number. And I would say that digital tech and monitoring of data had a huge part to do with it. We started with something called EVEN, Electronic Vaccine Information Network, supported by global partners like Gavi. You can track the movement, the dispatch, the deployment of vaccinations around the country. And the same thing was converted to what we called COVIN, an open source platform, COVID vaccination network, people's registration, people's dosing, people's digital vaccination certificate, all occurred via this open source platform. So I think we learned a very, very important lesson that tech can enable scaling of healthcare in the worst of times with accuracy, precision, and quality that is impossible without it. And of course, it must be used well. And like I said, open source is such an important part of it. Any country now that wants to use the platform but doesn't have the background to build it can just take it forward. I'll stop here for now.
Thank you, Anurag, and thanks for correcting me. Even I am nervous sometimes when I launch a Lancet Commission report. I'd like to move on to Ran. Ran, you were really in the middle of the Israeli response to COVID-19. Share some of that with us, and does this, some of the notions that the Commission put forward, data solidarity, etc., how do they relate to that?
Okay, thank you for that, Ilona. It's indeed the case that in Israel, years of investment in digital health infrastructure and in harnessing digital innovation for proactive population health paid off during the pandemic. It was basically a stress test, not only for health systems, but also for societies at large. So we have for the last decade been cultivating innovative approaches for population health in Israel. We've been using proactive prevention, predictive modeling to assess individual risk scores for health outcomes, negative health outcomes throughout the entire population, and then proactively approaching the highest risk individuals in society and offer them preventive care for chronic diseases, for diabetes, coronary heart disease, renal disease, and others. Now, this exact mechanism was put in place in the earliest stages of this pandemic, where we quickly deployed an algorithm that identified the patients at the highest risk for complications from COVID and proactively approached them through their healthcare providers in order to provide them advice on how to stay safe and how to perhaps divert some of the care that they need to receive from usual care to online sources. Now, this is a good opportunity to mention that Clalit in Israel and in Israel in general, primary and pediatric online care has been provided for over a decade at no cost as part of the basic universal health coverage of the population. So these digital health innovations allowed us to reduce potential disparities in individual response to the pandemic. We talk a lot in the report about whether the digital transformations are going to be something that will widen the gaps or basically be helpful in perhaps narrowing them. So I think that overall, this brings three key recommendations in the report into light. One is that the importance of long-standing investment in digital health infrastructure as an enabler of this transformation as a determinant of health. The second is the use of best buys, digital innovations, in the daily practice as means for further enhancing access, even within the existing universal health coverage setting, to outreach for those at most need of care. And finally, the ongoing use means ongoing training of the workforce in this type of digital use. And this brings trust in the innovation and in the actual provision of these services. So all these aspects were stress tested in the pandemic, and I think they proved their impact.
Thank you, Ran. And GD, looking at this from Nigeria, what would you say?
Well, I think that the report itself kind of lays a solid foundation for for adoption and what is going on in Nigeria. During the pandemic, really there was uptake, an increase in the use of mobile technology. As you know, Africa, especially Nigeria, has a high population of young people. It had its advantages and disadvantages. Advantages because of the social distancing, people were now relying on their mobile phones for information. People were using their phones to be able to get information from the Nigerian Center for Disease Control. So you come to a point where it's a dichotomy between those that are connected and those that are not connected, right? So what we're trying to focus on is how do we ensure that everybody is counted, first of all, counted and visible, then connected? In the previous panels, we talked about the infrastructure required for connectivity. I talked about the kind of the Maslow's hierarchy of digital transformation. Is there electricity? Is there the data? And is the data available for people to connect? So in a sense, what are those pillars that ensure that there's connectivity? Following connectivity, that there's appropriate use of the data solidarity, which we've talked about. And most importantly, how can you harness that data for public good? We saw a fantastic example with the Nigerian Center for Disease Control and the fantastic work that they did, which resulted in Chikwe being shipped over to Berlin. But it shows that, first of all, with the right infrastructure, the right governance, the right use of data, that you can actually use the data for public good and improve disease surveillance, access, and so on. So I think that the report really lays a solid foundation, not just for the users in terms of the importance of digital literacy, the importance of infrastructure, the importance of data governance, but also the regulators. They need to be also part of the digital literacy. They need to understand the power of the data that is being collected and how they can use that knowledge to better govern, which is, again, what the report highlights in terms of the right principles and policies behind data governance, such that there's appropriate use of the data for public good.
Thank you for that, Njidi. And before I came here, I was on a panel with Chikwe, and a number of the data issues in relation to the WHO hub on pandemic intelligence were also raised, and the issue of open data, data solidarity, other forms of data governance for pandemics and beyond is becoming clearer everywhere. I think particularly your point, we've said it for general literacy, but it's also your point about the digital literacy of regulators is an absolutely critical one, and an issue that probably needs to be picked up. Maybe I go back to you, Anurag, from this notion of digital literacy and on the one hand, and health literacy on the other hand, of the regulators, because India has been so active in this field, both in terms of regulation and technology development, etc. Can you share some of those experiences with us? And is India so far advanced that they don't need to read our report anymore, or where is it at?
No, I think no matter where you are, our report has value for everybody, because fundamentally our report is about principles, and trust is on big part. So India is a bit different in some sense that we spent a lot of time building a basic infrastructure focused on a digital ID and a digital payment interface by which you can have biometric identification of almost any Indian and ability to transfer funds, identify, carry out transactions. Now, this became a core building block upon which, for example, the COVID vaccination was built. But here comes the obvious problem, right? Trust. So if you require everybody they must part with their biometric identification before they get vaccinated, all that's going to happen is people who don't trust will not get vaccination. That's not good for society. So on one end, you must work on building trust. On the other end, you must build fault-tolerant technology. Somebody comes in, they refuse to share their ID. How will you do it? Somebody comes in, they are willing to, but they don't have the digital literacy that we talked about, or the tech literacy. So you have to put people on the ground to help people. And in the worst case scenario, if nothing fails, you don't let people go back unvaccinated. You find another mechanism to take care of the data and build it back. So I think for India, the big lessons are diversity, democracy, requires you to have a game plan, stick to it to a reasonable extent, but be ready to meet the wishes and the needs of the people. And that's what our report says, really.
Thank you, Anurag. We only have a few more minutes left, so I want to go first to Ran, then to Njidi. Could you say something about the trust architecture? How is that in Israel? How big is the trust, and what still needs to be done, Ran?
I think really that this is the key aspect of everything that's mentioned in our report and in real life, actually. The example I've given before could not have happened if there weren't available masses of data in data sets that were being able to be used for the common good. Now, the availability of these data for this purpose would not have been in place if we haven't been building the governance architecture for years. We've been very careful and very wary in the allowed uses of this data in order to build this trust. The data is kept at the source, at the trusted care providers, and is made available for research and development only under very strict rules that had until now never been breached. So in the pandemic, this trove of data is really helpful in mitigating the pandemic. I mean, just a few examples in determining the impact of the pandemic, the detrimental impact, and the need for immediate steps in supporting what was later on the world's fastest vaccination campaign, 60% of the population within a matter of a few weeks. And then finally, and most importantly, in assessing the interventions and building the trust in the public that these interventions actually work in order to reduce hesitancy and increase acceptance. So I think in the same line of thoughts, I think as our report continuously says, building an architecture of trust and data solidarity and explaining what is the use of the data and how it is used for the benefit of all in a way that is socially accepted is the only way forward in building something that is sustainable in our ability to utilize data in order to increase care effectiveness, reduce gaps, and take us towards basically everything that goes from universal health coverage to access to healthcare for all.
Thank you, Ran. Njidi, view from Nigeria, trust architecture, building it.
Well, I think that a lot of that is ongoing now. The government itself, I think, has a central role to play. They've started out already putting out a new regulation. It's called the National Data Protection Regulation. Of course, there's movement from the regulation to implementation. But first of all, I think that regulation needs to be put in place. Then working with both public and private sector to find a way to bring all the different parties together. But there's still a lot of work to be done because there's a lot of suspicion. There are quite a number of people who are left out and unconnected. So the first effort really is how do we get the government working with developmental partners or even donors to invest in the enablers of the system itself, the infrastructure, then showing transparency in the use of the data and slowly building up to the point that trust is built. But right now, the trust, I must say, is very low. So the meeting of minds between the regulators and the private sector, where majority of the data is actually domiciled, needs to come together. But I think the government, both national and subnational, has a very central role to play. So I understand the Minister of Health for Nigeria is in the conference somewhere, as well as a few of his officials. So this is something that I'm hoping that we will take the report to them on a roadshow, just to go through some of the things that need to be done. They also have a digital strategy, but it's again movement from the paper into implementation. And most importantly, something Nigeria talked about is the involvement of the youth. Part of the study that we had done as part of the commission work was looking at the digital technologies of quite a number of African countries. And we found that not a lot of them have any mention of youth or even their involvement in developing some of the strategies. So that trust element has to be developed by involvement of not just the people in the range right now, but the young people who ultimately will inherit the system. So that trust needs to be built by clear guidelines, policies, and transparency, and involvement of the different stakeholders, including the youth.
Thank you very much, Ron and Jidi and Anurag. We have to make another change up here on the stage. Thank you. And I would ask the youth panel to prepare themselves to come up here. And I think the audience can get a feel for what a joy it was to work with such highly competent commissioners, and how interesting the discussions were, both in smaller groups and the larger commission meetings. And the wealth of that knowledge is, of course, reflected in the report. You will see many examples in the report. You will see many checklists that you might be able to use as you're developing a policy or a program.
Thank you. So it's a great pleasure of mine to introduce two of the Global Health Futures youth officers. We have Brian Lee Hang Wong. Brian, please join us. We have Inau George Stevens. And we also have Inez Viva from the International Federation of Medical Student Associations. Inez, please join us. Thank you.
So without much ado, because we're pressed for time, I'm not going to say as much as I have in my briefing, but give the voice to the young people straight away. Just to underline that we were very keen to have strong youth voices, not just one youth commissioner. I'd like to say a special thanks to the Swiss Development Agency for actually making it financially possible to have such a youth group. You will probably hear more about the Global Youth Survey that we did, where we heard the voices of over 20,000 young people from 176 countries. So you will hear more about that. For me, it's just to say how important it was to have that voice, and not just to integrate that voice into how we wrote the report. They actually influenced the report and the language of the report, but also that their own voice could be heard with a separate youth statement. So without further ado, Brian, over to you.
Thank you, Ilona. It's a pleasure to be here today. So my name is Brian Wong. I'm the youth officer of the Lancet Financial Times Commission. And I just want to talk a bit about my personal experiences with, being on the youth team of the Secretariat. It's been a real pleasure to work with youth all around the world on, contributing to the Commission's work. And something that I've really seen is that, the meaningful enfranchisement of youth has been a real central tenet of the Commission's work. We've seen early on the co-chairs and the commissioners advocating for the meaningful engagement and holistic and strategic approach to meaningfully engaging youth in the Commission's work and including diverse voices. And as Anurag had mentioned, this led to the establishment of the youth team, which I'm on, as opposed to just token youth voices. And we really had the agency to do our own thing. I'd like to touch on two main ways which youth have been able to contribute to this work and to inform the recommendations of the Commission's report. The first is through youth consultations, and we've managed to facilitate a lot of open dialogues to hear the concerns and propose solutions from youth on the types of future health governance that they want. Early on, we had 35 youth participants representing 23 global youth networks, IFMSA, which was one of them, participated in a two-part youth consultation titled, "What Do Youth Want to See in the Future of Health Governance?" And the aims of this were threefold. The first were to hear how youth, as a group, identified. The second was to understand the main concerns and propose solutions with respect to digital transformations in health. And the third was to provide a space for the commissioners to hear from youth on the types of health futures that they want. So this intergenerational dialogue that we've been hearing about earlier today. And the culmination of these discussions has led to the co-creation of a youth statement and a call for action, which complements the Commission's report. And this underscores three key aspects that youth want to see in this future of health governance. The first is a human rights-based approach to health. The second is a strong and inclusive governance mechanisms. And the third one is fostering of digital skills, education, and innovation. We also call upon various stakeholders at all levels and in all spheres to take action towards strong governance and of the digital transformations of health futures, involving youth at every single level to ensure that the right to digital health and human rights-based approach to digital health are recognized, and that digital health skills are fostered as they are vital for innovation, trust, as we've heard, and equitable uptake of digital innovations and digital transformations. Youth really must be involved as equal stakeholders throughout this continuum of research and learning, as well as digital innovations, program development, and policy-making decisions. We've also hosted other youth dialogues, such as the online global dialogue at the ECOSOC Youth Forum, where we launched the Youth Network, which you'll hear about later. We've spoken at the Big Six Youth Summit and the SDG Youth Summit, which IFMSA was also a part of. The second main area that youth have contributed was through youth blogs and podcasts. We hosted a special thematic series titled Health Futures, Youth Voices at the Forefront of Digital Health Governance, which invited youth under the age of 30 to share their views and voice their opinions on issues related to digital health governance, expanding our blog authorship to include future leaders of health futures. We've also had a podcast, which I had the pleasure of hosting, called Voices of Digital Health, which was another way that we had an intergenerational dialogue with commissioners, some of whom are here today, such as Ran. And all in all, I think the Commission has done a fantastic job in setting this benchmark for ensuring that digital health governance is co-designed and co-governed for and with youth to really drive forward this agenda of achieving desired health futures for all. And I'd just like to say that it was a real pleasure to take part in this, to work with youth from across the world in co-creating this, all these aspects, some of whom I knew before, some of whom I've only just met, and some of whom I'm yet to meet. So I'd like to hand off to my fellow youth team member, our Georgia Stevens, who's a clinical officer for sexual and reproductive health in Cameroon, and unfortunately could not be with us today. Over to you.
Thank you very much, Brian. It's a real pleasure for me to be here today and to talk about the youth work of the Commission. To me, the meaningful engagement of youth was critical in the development of the report. With the launch of the report, the Governing Health Futures Youth Network and the commissioners know that youth are a critical voice in amplifying the report findings and also translating these findings into concise actions through advocacy and engagement. All along my stay with the Commission, we had the recruitment of 5 regional youth champions who are active on social media and are well connected to agents of change and who share similar foundational values for digital health governance, such as democracy, solidarity, inclusion, equity, and human rights, and who were selected to engage in Governing Health Futures 2030 to support in the advocacy and dissemination of the Commission's report findings. I was also involved in the regional study on the involvement of youth in drafting digital health technologies in Africa. We had a 10-country study. And the Commission has been gathering information on approaches to digital transformation of health systems being taken around the world, particularly in countries where young people under 25 make up a substantial proportion of the population. So within the Commission, we conducted a study in 10 African countries with young populations, such as Cameroon, DRC, Ethiopia, Liberia, Malawi, Mali, Niger, Nigeria, Tanzania, and Uganda. And that was to better understand national priorities and activities for strengthening digital-enabled health systems, barriers to implementation, and the extent to which the needs and views of young people have factored in these efforts. And it'd be interesting to note that during the study, we found out that every country strategy had a strong emphasis on strengthening integrated health information systems, but none of the digital health strategies included in the study gave consideration to particular needs of views of children and young people. So you see that young people were not very involved in this drafting of digital health strategies in these 10 countries. So these were the main things which I was able to co-create while along my stay within the youth team of the Commission. And at this point in time, I want to pass over to my co-panelist, Dr. Ines Viva, who is the Vice President for External Affairs of IFMSA, which represents 1.3 million medical students from 130 countries and who are just completed have medical studies in Portugal and Taiwan. Over to you, Ines.
Thank you so much, and thank you so much. We have had here important contributes, and I'll be happy to provide you with IFMSA contributes as well. First, good morning, good day, everyone, both in person and online. It's really a pleasure to be here with you. And also, I just wanted to give a huge shout out to the Commission for all the support they have provided us with in terms of either supporting us in our events or always giving us advices with regards to digital health. So as Brian mentioned, he was talking about youth and call for action. We actually have 3 IFMSA representatives as co-authors. So this was our very first collaboration with GHFutures2030. But then also talking about education, as it was highlighted, it's very important. And here GH Futures had a very important role this last event that we had and that we called the Youth Pre-World Health Assembly, that some of you might know, but which aims to educate and empower our members and students. And the main spotlight this last one was in regards to digital health. And as it was highlighted, digital health and digital health technologies are not accessible to everyone. And here we had the huge support from the Commission because they were able to give the resources so that we had members that otherwise wouldn't be able to attend online this capacity building event. So thank you very much, we really appreciate it. So, and besides that, in IFMSA, we have 2 main gatherings throughout the year, one in March and another one in August meeting. And in these events, we have represented over 140 national member organizations that come across 130 different countries. So you can see the huge magnitude of and the representative and how inclusive this event can be. And there's always a theme event that is associated, which means that the sessions will, let's say, revolve around that theme event and the education of our members. And one of this past March meeting was about digital health. So it was when, let's say, we decided in IFMSA to start really working on digital health and advancing our efforts, which we are very much looking forward to continue this next year. Besides that, and since we also recognize that research is very important, and it's very important for us to know what is the actual status of our medical students' knowledge in regards to digital health and how they actually perceive the importance of digital health, we did a global survey to access this. And the results, let's say, they were, just to give a very brief summary of the results, like we have over 85% of our respondents saying that, in fact, they think that digital health and digital health associated skills are really, really important for them as the future health workforce. So this is the very first point that I would like to highlight. The second one is that also over 80% think that they aren't educated enough on this topic, and also that this topic needs to be included in the medical curricula. So this is important data for us as IFMSA and also for our members, because then they'll be able to take this to their national governments, their local medical schools, and present these results to their deans, and we'll be here to support them throughout their way. So we are really looking forward for our next collaborations with GH Futures, and let's see what the future holds, but I'm sure that it will be great and that we will be here supporting each other and, yes, just providing a safe environment so that we can actually have meaningful youth involvement. Thank you.
Thank you very, very much. Thank you to the 3 of you, but there's not much time left, even though I have a whole list of questions here I could ask you. But if I could just have one very short answer from each of you, what was personally most important for you in working with the Commission? Did it change anything for you? Ines.
Okay, I'll go first. Thank you very much for this question, because I'll try to keep it short. So most of the times we are consulted, let's say, but it's just consulted, not actual involvement. And for example, in this, the youth call for action, IFMSA was actually there, was actually in the write-up of the report. So this is what is meaningful youth involvement, and this is how you are following up on that. So thank you very much.
Thank you, Ines. Thank you for that feedback. Ino, are you there?
Yes, I'm here, Ilona. Yes,
Yes?
I must say that being with the commission has taught me a lot, and I learned about meaningful youth engagement. You know, coming from Cameroon, a developing country, it was an opportunity for me to be involved in issues that directly concern us, especially digital health, which is a hard to fetch within Africa and sub-Saharan Africa. So I must say I was meaningfully involved, and I represented the voice of young people, especially as a young medical professional. My input was taken into consideration in the drafting of the report. So to me, it showed me that indeed my voice counts and the voice of young people counts. Thank you.
Thank you. Brian, last short words from you.
No pressure. So I think, one thing that really stood out to me was that, for once in a very long time, the young people were actually treated as experts of their own lived experiences. We were at the table, we were given, copies of the report to review, we were involved in a lot of the commission meetings as well, and I think, this being able to meaningfully contribute to a lot of this, as well as, having the commission go into spaces where we already occupy, as opposed to just being there, made so much of a difference.
Thank you, Brian. And I might let all of you know that the work of this youth team, I already mentioned the support of the Swiss Development Agency, is going to continue on until June 2023. There's a whole number of plans already, and one of them is for a youth hackathon in November in Geneva. So together with the Geneva Hub for Global Digital Health and Solutions for Health Futures. So please go on our website, because we'll call on youth health innovators, digital innovators, to be part of that and to move our recommendations forward. I understand you've prepared a film, a short video, and we'd like to show that now.
Today, we call upon all the policymakers to recognize the potential of digitalized generation by giving them access to opportunity, resources, and access to use the digital as a critical tools to challenge the current norms.
We call on young people to join the government, launch social enterprises, support the academe, and empower civic groups, so that together we can champion human rights-based health policies, improve digital health literacy, invest in innovative digital health technologies, and boost youth participatory governance towards a healthier, more inclusive, and a more sustainable future in a digital world.
What we are expecting as youth from the launch is the meaningful engagement of young people in the decision-making processes when it comes to the development of health governance models that dictate the standard of health and well-being of youth. This can be achieved through addressing the critical considerations and call to actions regarding the future of our well-being and safety in the digital world.
Intersectionality in the conversation of human rights in the digital age is non-negotiable. Youth are not a monolith, and as such, our diverse, unique experiences must be the focal point in these conversations. Stakeholders must ensure that youth are not an afterthought, but are active participants in the creation of our own future.
So thank you for that. Even more youth voices, and we're really thrilled about your feedback, about the cooperation. And actually, I just got an email the other day because I had used the term that you had so insisted on, that enfranchisement rather than empowerment. and I'm using it all the time now. So I got this email back, can you please explain to me what enfranchisement means, from a very important policymaker. So I think there we go, you're having an influence on many fronts. Can I ask Naomi and Andrew to come back up here so that we close? And I think Anurag is with us online as well as the co-chair. Last words, co-chair.
Just thanking everybody for a wonderful experience or a very interesting time. And like I said when I started, I think we're going to have lots of questions in due course. If you ask good questions, the answers will follow. Thank you.
So just to give you a feel for some of the most important components of that commission, the Lancet and the Financial Times, the youth, and us two co-chairs, and the many commissioners that you've already met. Naomi, any final words?
Aloni, you might remember that I made a joke as we were coming up to the end of the commission, and I said sometimes we wished for more time. You know, we felt like we didn't have enough time coming up to the deadline. And I think we wished for more time because this is such an evolving picture. There's so much more to say. So the Commission's delivered all of the foundational recommendations, but having this conversation now, we've just identified so many areas that we still need to work on. So looking forward to it.
Andrew.
So, I mean, this was an extraordinary project, and as you said, Ilona, it required working under pretty unusual circumstances over the past 2 years, not intention. But I think the outcome in terms of some of the reflections, the research and the policy recommendations have been really valuable and strong. And of course, the Lancet traditionally has deep expertise in convening these sorts of commissions, particularly to look at clinical and other direct disease-related areas. And I think our partnership's been a very interesting, pioneering one to also engage, of course, that really important intersection with policy and business. And we hope very much to be involved in hearing next steps and generating feedback. So we welcome all sorts of reflections from practitioners of different sorts around the world to these findings.
Thank you, Andrew. I would be amiss if I did not make a very, very important point. Because of the COVID regulations, not everyone that should be on stage is on stage. Some of them are here in the room, others are not. One of our team members actually has recently, despite being vaccinated, contracted COVID. So I want to make this point about the extraordinary team Anurag and I and the commissioners had to work with us under the leadership of Afrodita, who is here with us. There are some other members that are here. Michaela, who used to work with us. Whitney, I think, is somewhere. And some of them are online. Without them, we could not have done this. And we'd like to thank them. Louise, I hope you're out there. Christian, I hope you're there despite being ill. So thank you to all of you. It's become a true family, a Lancet family, and a lot of trust being built, a lot of friendships being built. We even had a little commission baby from Whitney. Thank you very much. And so we were ever more motivated to think about digital health futures, because seeing that wonderful little bundle made us understand what a responsibility we have to actually create these better futures. Thank you to all of you. Thank you for being interested in this launch. Thank you again, we've already said, to the sponsors, the supporters, Lancet, Financial Times, also as co-hosts, our youth team, the Secretariat, and the many, many people who discussed with us, who came to our meetings, who came to our conferences. Unbelievable input of hundreds of people. You'll see a bit of a list of that in the Commission report. Thank you.